The law of unintended consequences is what we're going to talk about today. We're talking about Bill 30, the Guam Memorial Hospital, Guam Regional Medical Center, the recent report from the OPA's office, and the perennial $30 million donut hole in Guam Memorial's budget. The law of unintended consequences reads that sometimes you do things for the benefit of a particular group, but due to unforeseen circumstances, the people are worse off than they were before. And that's the situation here with Bill 3035. Bill 3035 is a rescue bill. It's corporate welfare for Guam Regional Medical Center in a nutshell. Basically, what's going to happen with this bill that was passed by 13 senators. Senator Therese Terlahi was absent excused because her mother died. Senator James Moylan was excused because his family is in the insurance business. But without exception, 13 of our senators drank the Kool-Aid, and with no financial data whatsoever, they rushed in and passed this bill, which basically gives welfare support to Guam Regional Medical Center. So when we look at the fact that the Guam Memorial Hospital is kind of like the Titanic, and we have to only look back to last year when the previous administration had a hearse parked in front of the legislature, and they were demanding $125 million in borrowing or tax increases to fix Guam Memorial Hospital. Well, Guam Regional Medical Center is also like another sinking ship. They're having financial struggles that have been hinted at in the news, with missing payments required under their GITA's qualifying certificate. And then we have that court battle between the major stockholders taking place in the Philippines. And now their qualifying certificate is under review. So already, right now, the taxpayers of Guam have given Guam Regional Medical Center a $170 million tax abatement over the next 20 years. So whether we like it or not, we're publicly funding Guam Regional already by reducing the taxes they should have been paying to the treasurer of Guam. So the inconvenient truth time is that the problems that are affecting Guam Memorial Hospital are the same problems that are affecting Guam Regional Medical Center. We have a small population, just a little over 163,000 people. We have 44,000 households, unique family units. 60% of those families, annual gross income less than $50,000. 34% of those employees are on food stamps. And when you look at all people working on Guam, 87% of those employees are making less than $40,000 a year. So that is the same problem that Guam Memorial has, the same problem that Guam Regional has. A small pool of patients and a very small pool of insured patients. A large pool of uninsured people. The taxpayers of Guam can't afford 2 hospitals on life support. As we saw in 2018, Guam Memorial Hospital's problems went from bad to worse, with the potential near decertification for Medicare and MIP. During the campaign, I proposed putting Guam Memorial Hospital in a federal receivership, just like we did with the landfill. Because when we look at the history of government of Guam, the only changes, meaningful changes that had taken place in the way government of Guam operated in the power, water, mental health, education, corrections, and solid waste came after federal receivership was imposed. Guam Memorial Hospital is a $150 million business. It's losing $30 million a year, It has written off $140 million over the past couple of years. It is badly managed. That is the number one problem with Guam Memorial Hospital. Candidate Leon-Guerrero came out strong against receivership, saying receivership is not a solution. She proposed putting in strong leadership. She was going to put together a strong leadership team. What we're looking at is the second problem faced by Guam Memorial Hospital. It's a staffing problem, starting at the top. Now, according to the American Hospital Association performance benchmarks, a hospital, Guam Memorial size at 158 beds, should have somewhere between 600 and 650 employees. We have nearly 1,000. And I was surprised when I looked at the staffing report preparing for this video to learn that we have two CEOs. We have Peter John Camacho, who is now an administrative assistant at Guam Memorial Hospital, but he's still making the same salary he did when he was the executive manager of Guam Memorial Hospital. So now we have Lilian Perez Posadas, and I don't know her, never met her. All I know about her is what I read in the newspaper. And what I read in the newspaper, she's a former nurse who's spent 11 years managing benefits at United Airlines. That doesn't say strong leadership team to me, because now we have joint executive managers, one who nearly lost CMS certification and one who has never managed a healthcare institution, as far as I can determine. We're paying $513,380.92 for these two people. For $500,000, I would have imagined we could have gotten someone that the campaigning governor, Leon-Guerrero, said she was going to get. You know, someone with experience and a reputation. Maybe somebody like Art Usajima, who prior to taking the helm at Queens Medical Center had 14 years progressively increasing hospital administration experience after 7 years of managing medical facilities for the U.S. Air Force. Queens Medical Center is paying him $585,000. Why couldn't we use this 513 to get somebody of Art Ushijima's caliber to manage Guam Memorial Hospital? Let's compare the two. Guam Memorial Hospital has a revenue stream of $150 million. It has 158 beds. We have 38 doctors on staff and 416 nurses. And our CEOs together combined are drawing $513,000 in change. Queens Medical Center has $2.9 billion in revenues. It has 583 beds. They have 1,100 doctors on staff. They have 1,160 nurses on staff. And the CEO's base salary there is $585,000. For $513 that we're paying here on Guam, why couldn't we get somebody of Art Ushijima's caliber? Leadership's a problem, staffing's a problem. We have a third problem at Guam Memorial Hospital. 90% of the self-insured aren't paying their bills. But when the Office of Public Accountability did an audit, they also learned that the hospital staff spends very little time or effort trying to collect money from the self-insured. In fact, when I read the report, it seems like collection efforts are limited to holding birth certificates hostage and collecting, attaching tax refunds. That seems to be the extent of the efforts at Guam Memorial Hospital to set up payment plans and collect from the uninsured. I've heard a lot of horror stories from people who owed Guam Memorial money, how difficult it was for them to try to pay the hospital. So it's obviously a leadership problem. because to let $20 million go uncollected is a big red flag for me. And the fact that Guam Memorial Hospital keeps asking for $30 million, hell, if they just collect the $20 million, they wouldn't need that 30. But realistically, ever since Guam Regional Medical Center opened, we have seen a shift. The patient and inpatient and outpatient caseload at Guam Memorial Hospital has been dropping since Guam Regional opened. The only category that hasn't dropped was emergency room visits, which are a staggering 21,000 in 2017. The fact that so many people don't have insurance and are in such low-wage jobs they have to use the emergency room as their general practitioner is a big problem, and one that we are not going to solve under Bill 30-35. The only way we solve these problems is we start at the top. We replace the leadership at Guam Memorial Hospital with someone that actually has experience and knows what they're doing, and not a political appointee. And the only way that happens here on Guam is if the people of Guam demand that the governor and the legislature bring in a receiver so that we can cut all the politicking out of the administration of the hospital, like we saw the politicking get cut out of the landfill, and have more of our dollars go from the top line to the bottom line and provide more and better benefits at a more affordable cost to the people of Guam. But that will only happen if we break the cycle of well-connected political insiders being put in positions of great responsibility with no skill, experience, or track record. So until the day comes that the people of Guam demand a federal receiver, our hospital will continue to take on water like the Titanic, depriving the people of Guam of that badly needed healthcare lifeboat that we need, because not all of us can afford to go to the Philippines or California for medical treatment. Help make a difference. Let's stop the ship from sinking. Like this post, share this post, follow this page for updates, and tell the governor to vote no on Bill 30-35. I'm Ken Leon-Guerrero, and this has been a Guam Citizens for Public Accountability presentation.